Hello, this is Bryant Myers, author of the book PEMF, The Fifth Element of Health. If you are experiencing arthritis, back pain, neck pain, migraines, body aches, fibromyalgia, or any form of pain whatsoever, then this may be the most important video you have ever seen. So please just press pause for a minute, grab a pen or pencil, and take notes and watch this all the way through. You do not have to suffer with pain anymore. In this video, I'm going to share with you what Dr. Oz called the biggest breakthrough in pain management he had ever seen, called PEMF therapy, which stands for Pulsed Electromagnetic Field Therapy. And it's related to magnetic therapy, but as we'll see, it's much more powerful, it's deeper penetrating, and the benefits for both pain relief and healing and regeneration are even beyond what magnetic therapy can offer. Also in this video, we're going to look at what pain is, why you experience pain, and the big problem with pain medication. And we'll share PEMF therapy as a natural, non-invasive, and effective solution to end pain once and for all. So let's begin by looking at some statistics on pain. Pain affects more Americans than diabetes, heart disease, and cancer combined. Chronic pain affects 100 million Americans, according to the Institute of Medicine of the National Academies. 1 in 3 Americans are affected by more than 100 types of arthritis that usually results in severe pain. Fibromyalgia affects 12 million Americans, most of which are women. And research shows that 50 to 70% of patients die in moderate to severe pain. Now, here's the most common forms of pain of all the pain that's been reported. Low back pain was the most common, about 27%. Severe headache or migraine and neck pain both accounted for 15%. And facial pain was about 4%. That's the mouth, teeth, jaw, and the eyes. Just want to share these statistics just to show how prevalent pain is and just what a major problem it is in this country. So what is pain? Well, pain is vital to humans because it signals that something is wrong. Thus, pain is not a disease, but rather it's an important warning sign to protect the body. Now, pain has many manifestations. It may be manifest as throbbing, cutting, piercing, pressing, dull, or paralyzing, and it may occur suddenly or periodically. And the causes are varied. There could be heat, pressure, stretching, injuries, and many other factors to cause pain. And it can be a result of chronic diseases like cancer, heart disease. Pretty much every disease has pain as a side effect of some form or another. The International Association for the Study of Pain widely used definition states, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So pain is good. It motivates us to take our hand off the stove. It's like the engine light in your car. When the oil light is on, you know something is wrong. So it does serve a purpose, but sometimes the pain signal can be much too strong, as we'll see. Now, chronic pain is simply a form of pain that persists over time, where the pain signals keep firing in the nervous system for weeks, months, and even years, even after the body is healed. Or it could just be that the body never did heal. Like with arthritis and inflammation, sometimes the inflammation is always there. Now, how is pain perceived? Nociceptors is just a technical term for a receptor of a sensory neuron that responds to potentially damaging stimuli by sending signals to the spinal cord and brain. And the process is called nociception. It usually causes the perception of pain. So we do have nerve cells that actually are sending signals to our spinal cord and brain telling us that something is wrong. Again, if your hand is on the stove, the nociceptors will relay to your spinal cord or brain, especially to your spinal cord right away, to take your hand off the stove. The perception of pain involves these pain receptors, and they relay the stimuli, as we said, to the spinal cord and brain, and they're in varying densities across the body. On average, each square centimeter of your skin has more than 300 nociceptors. In order for the pain message to reach the brain rapidly, the pain is relayed at the rate of several meters per second. There's a switching point in the area of the spinal cord that decides whether the complaint is important enough to be relayed to the brain. The cerebellum and the pituitary gland and other glands in your brain react to the message by secreting opiate-like substances called endorphins, which we'll talk about more in a minute, which inhibit the transfer of the pain stimulus to the brain, and it certainly gives relief as well. There's basically 2 mechanisms. There's the signal that creates the sensation of pain, and then there's endorphins which relieve the pain. And there's a whole cascade of hormones that gives you the sensation of pain. But endorphins and other happiness hormones in the brain, like serotonin and a few others, help to make the body more at ease and more relaxed, and it helps to sort of soothe the pain. And interestingly, as we'll see, a lot of drugs are opiate-derived type of drugs that are for pain relief, like Vicodin and Percocet and oxycodone and morphine. They're all opiate-derived, so your brain can create those naturally. Let's take a quick look at the allopathic approach to pain. You can call this the numbing and dumbing approach to pain, because what it's doing is it's giving you synthetic chemicals that basically turn off the sensation of pain, but unfortunately they have side effects and they don't fix the problem. Prescription painkillers are also considered the major contributor to the total number of drug deaths. In 2007, for example, nearly 28,000 Americans died from unintentional drug poisoning, and of these, 12,000 involved prescription pain relievers. So let's talk now about PEMF, what I call the smart choice. PEMF, or pulsed electromagnetic therapy, is a natural, non-invasive, safe, and effective treatment for pain relief. It is related to magnetic therapy, but instead of a constant magnetic field, it provides a magnetic field that changes with time. It really is the most effective, natural form of pain relief that there is. And like I said, Dr. Oz featured PEMF on his show in 2011 as the biggest breakthrough in pain management he had ever seen. There are 10,000 research studies, including over 2,000 double-blind studies, that show that PEMF therapy works. It is very well researched, very well established, and in my 7 years of experience with PEMF therapy, pain relief is by far the number one reason people invest in a PEMF therapy device. PEMF therapy helps with pain relief in 3 powerful ways. These ways are all been research proven. Number 1, PEMF increases endorphins, serotonin, and other hormones that help to relieve pain. Number 2, PEMF therapy reduces and temporarily interrupts the pain signal, and less signal equals less pain. And number 3, and most importantly, is that PEMF therapy actually heals the problem. Using the analogy with the oil light going off in your car, PEMF therapy is like putting the oil back into your car so the engine light turns off like it should. Where the traditional medicine approach is sort of like cutting the wires to the engine light so that you don't know there's a problem, but the engine's still burning up and the problem's still there. Not only does it symptomatically relieve pain, but it actually heals and regenerates the tissue so the pain really goes away. So how does this work? Let's begin with endorphins. Endorphins are also the feel-good hormone, or the happiness hormone. Endorphins are your body's endogenous morphine or natural opiates. Your body makes opiates. You don't have to take morphine and oxycodone and Percocet and Vicodin and all these opiate drugs that your doctors can prescribe, because there's ways to naturally stimulate endorphins in your body. And PEMF therapy is definitely one of those, and there's research to prove that. And when your endorphin levels are high, you naturally just feel happier. You feel more relaxed. You feel less stress, and you certainly feel less pain. Why do you think that most of the most powerful painkillers are opiate-related painkillers? It's because endorphins have been shown to be the most effective form of pain relief. But your body can create them naturally. And not only PEMF therapy, but also massage, yoga, meditation, deep breathing. We know that exercise increases endorphins, deep sleep, low stress. There's certain foods that increase endorphins. Good hydration increases endorphins. And certainly just smiling. It's been shown that just smiling increases endorphins, even if you do nothing and just smile. But add PEMF therapy to all that and just watch the magic happen. You'll really notice some serious pain relief. So the second way that PEMF therapy helps, along with endorphins, is that it interrupts the signal that causes pain. PEMF generates microcurrents to run through the neural pathways, which reduces the signal needed to create the feeling or sensation of pain. Less signal equals less pain perception. Let me repeat that. Less signal equals less pain perception. So PEMF not only helps to improve your happiness hormones so you'll just feel better and feel less pain, but it directly decreases the triggering of the pain response. In doing so, it raises your threshold for pain so that you don't feel pain as intensely. And the third reason, like I mentioned, PEMF therapy is one of the best natural solutions for healing tissue, both nerve tissue, ligaments, joints. Wherever your source of pain, usually there's some kind of injury or some kind of trauma. And PMF therapy will actually help to heal and regenerate your tissues so that the signals for pain naturally go away. So in conclusion, PMF therapy helps with pain relief in 3 powerful ways. Number 1, it increases endorphins, your body's natural opiate-like compounds, to help naturally relieve the pain. Number 2, it reduces and temporarily interrupts the pain signal. And remember, less signal equals less pain. And number 3, it heals the problem and regenerates tissue so that the pain naturally goes away. Thanks for listening, and for more information,